Let's talk about a story of a woman who had 10 pads a day. Pretty typical for many of my patients, but she went from 10 pads to 0. We're talking about all things women's health, all things fibroids. This woman, when she would have a period, it would be so disruptive. She would have to call out for more just to sort of manage the flow. I treated her. I typically see my patients at 4 to 6 weeks after they've had an opportunity to sort of have a period or two. Now they sort of are aware of what is actually going to be their post-treatment period. So she came to me and she walked into the office. And typically when a patient walks into my office, I see smiles just kind of gleaming back at me. So she's like, it could be better. So we went through symptoms and her bloating had resolved, her constipation had gotten better. And we went through urinary frequency and urgency, that was better. I said, why does she look like this? And I said to her, tell me about your period. She said, well, I haven't really had it yet. Is that normal? That is just supposed to disappear? And I said, well, walk me through the last time I saw you 4 to 6 weeks ago up until now. She said, well, see, after the procedure, everything was fine within a week. I didn't see the incision anymore. And 3 weeks later, I had some spotting. So now I'm just waiting for my period to come. And I said, well, let's go back. You said you had spotting. I said, what was it? Was it dark blood? Was it cherry red blood? She said, cherry red blood. I said, did you have to wear anything during that time? She said, panty liners. How many days did it last for? 5 days. And I said, that's your period. She said, no. I said, yeah, 5 days, cherry red blood. I said, did you have any cramps during that time? She said, yeah, I had a little cramps, but they weren't like the cramps I used to have in the past. And I said, but you had some cramps. Yeah, I had some cramps, light cramps though. But she said, I only wore panty liners. And I said, that's your period. She went from just mean mugging to absolutely delighted that she had emerged from this bondage, 10 to 14 pads, to now panty liners. This is the transformation that really underscores the work that we do. If you are in bondage and you want to be liberated, join us. Dr. Mikhail Higgins. Tune in for more content.